Dopamine. Addictive learning.
Hello and welcome to Dopamine. So, what are we? We are an educational platform exclusively designed for medical students. So, we are committed to provide high quality medical lectures, in depth clinical cases, studies, and practical insight to enhance your medical education. So, without wasting a minute, let's dive into today's topic, which is how to study medical subjects. We do have various subjects, for example anat, physio, biochemistry, microbiology, pathology, and then we have medicine, surgery, orthopedics, pediatrics, obgyn, etc. So with a huge amount of syllabus present in a academic curriculum, so we need to remember each and everything in well manner so that we do perform well in our exams. So first and foremost, like let's see the challenges of studying medicine subjects. Okay, challenges of studying medical subjects. So many of the time we have faced problems such as massive syllabus. Okay, massive syllabus, like, which is way too much to understand, to grasp, to remember, and all those things. And the second point includes that we have pressure to perform in an exam, pressure to perform in our exams. So what happens, like, we do study, we try to remember as much as syllabus we want to, but while we are writing our exams, we tend to doubt ourselves that how do we write this, or how do we address to this question. And in that way we tend to confuse our brain. Hence, like, we tend to perform a bit less than what we have desired, that I'll be performing this in my exam. This is the second thing we always face. And the third thing is that we don't have time management. No? So time management, where? So time management in our classes, in our rotations, clinical rotations, and our homework, etc., classwork, etc. So all those things tend to pile up, and for that reason we don't do a time management properly, that we need to do this at this time, we have to do this, etc. So so let me tell you one thing. So how, like, you'll question yourself that why this guy is telling about this thing, that these are the things that we are facing. So here our platform Dopamine. Okay, so what it is designed for? So, like, a few years back when I was a medical student, that time I had a lot of problem, like, grasping the thing. I was a person who would learn from the others. Okay, I was kind of a visual learner. So that time, like, I did not had a subscription to any platform XYZ, and I used to go for the free lectures which are available on YouTube. So, like, searching and finding it out, finding the right content, and then studying, like, it took away too much of my time. So in order to avoid that thing, so we have come up with a platform Dopamine, which is specially for the medical students to understand topic in depth, with features such as in-depth medical lectures, clinical case scenarios, practical perspective, and guest lectures on monthly basis, so that you understand well, and all the content that you want for your medical career, or the for your medical studies, are available on one platform. So Dopamine is actually one platform for medical students. Okay, so we'll be covering each and every subject, we'll be covering each and every clinical case scenario, we'll be helping with a practical perspective, practical insights to enhance your medical education, and how to deal with patient, what are the patient doctor relations, all those things. Okay, so this was about us, Dopamine. So now let's understand the learning style, like how we'll learn properly. Okay, so understanding the learning style. So there are many people, there are way too much medical students. Each and every person has a different type of learning style. Okay, so some are the visual learners. Okay, visual learners. Visual learners, they tend to learn from the images or the diagrams, etc. All those things. And seconds are the auditory learners. Auditory learners who tend to listen to the lecture and then they understand the concept. Like for example, our best friend who is teaching at the last moment for the exams and all those things, like we tend to remember those things well than what we have learned. Okay, and then we have kinesthetic learners. Okay, so these are the special kind of species, kinesthetic learners. So, kinesthetic learners prefer hands-on experience. Like they need to have an experience, on the physical activity, like how it happens, how I'll feel when I see this patient. If a patient come with complaint of, for example, continuous bloating or continuous constipation, or for example we'll say shortness of breath, pain in the chest, etc. So like they want to visualize that patient in a real time, and then they want to decide that how I will manage this patient XYZ. And there's the thing how these kinesthetic learners work. So you have to figure it out that what type of learner you are, and it will help you to further decide like how you need to study. Okay, so see, and after that, after understanding what is a learning style, then we need to check which type of learner I am and the learning style that I prefer. Okay, and after that you have to adapt a technique to study. For example, mainly what I do, I give myself 1 hour. Okay, so in 1 hour I'll be continuously studying for 45 minutes, and then I'll take a 15 minutes break, and then again I'll repeat. So this is my the study schedule which I like to learn, like giving myself a small breaks and then again going back to my study routines. Okay, and again you can, for example, I'm taking here 15 minutes, you can take 10 minutes, you can take 5 minutes. Yeah, and it depends on, you can even take a 20 minutes, but it should be continuous. Like you should not take more minutes than the given minutes. Okay, so now after this, what you need to do is you need to like uh you need to create a study schedule. Okay, you need to create a study schedule. So in study schedule, we'll be mostly working on time management. So the time management, see, effective time management is actually crucial for success in medical student. It involves prioritizing your task, setting deadlines, and allocating specific time blocks for different subjects. By managing time efficiently, like we students can reduce stress, improve our focus, and enhance overall productivity. So at the end, what I think is a well structured schedule ensures adequate time for studies, rest, and extracurricular activities, leading to better work life balance and improve academic performance. So see, what we can do is for example, we have 9 to, let's say, evening 5, we have a college. We attend various classes, lectures, and then we have a clinical rotations. All this happens in this time. So in this time you need not to plan your this study schedule. You can do one thing, that is if you're an early bird, so you can start by 5 a.m. Giving yourself a study time from 5 a.m. to 7 or 8 a.m. So there you can study whatever subjects, whatever topic you have left behind, or which you're unable to understand, you can study in this time, because the grasping power becomes more in the morning rather than the night. And for example, you are not a morning person, you want to study in the night, so after 5, give yourself at least 2 hours, 2 hours of break, have fun, enjoy each and everything. Then after like for example 5 from 8 o'clock, yeah, 8 o'clock you have your dinner. Then from 9 o'clock you can start your study till whatever time you're good at, like till you sleep. Okay, for example my personal times are from 9 p.m. till 5 in the morning, and then I go to sleep. I wake up at 8:30, something like that, and then I go for my clinical rotations. So you need to have your time management done properly, and then you can like see the changes of your study, like grasping each and every knowledge and correlating the cases that you are seeing in front of you while you are in your clinical rotations. And at the same time, in time management, like studying, better take 5, 10, or 20 minutes for yourself, give a break, and then study continuously. Okay, so we need to balance the time between like our personal space and the study time, etc., all those things. So see, so now we have done with the time management, which was lacking. We have seen what the type of learner we are, how we learn. So at the end we have like what do we say, an effective study technique. Okay, effective study technique, which was which was researched in the Harvard, like that how a student can perform well. So they came up with 4 to 5 topic like sub points, which you should follow in your day-to-day life in order to have an effective studies. Okay, so the first one is active recall. Hmm? So active recall, you have to recall your like subject or the topic which you have read. And how you can actively recall, so you can have a flashcards. Okay, and then you can have a quizzes, and then you have like a teaching others. So teaching others, these are meant in the active recall. This actually helps you in order to understand and retain those topics in your brain. And the second point is like spaced repetition. Okay, spaced repetitions. So reviewing your material, like reviewing your notes, reviewing your notes at regular interval. So for example, at night you're studying. Okay, so in the morning, like when you have a free time, you can just go through your book once, that what I did study yesterday, what my notes like intend to say, can I understand it or not, like that. So, and after that the third point comes, which is mind mapping. Okay, mind mapping and visualization. Okay, so in mind mapping you can have your notes like create a map. For example, let's say there is an issue for the GIT. Okay, so in GIT we have constipation. Okay, then we have acid reflux. Okay, then we have for example, when we have like severe diarrhea, and then we have abdominal pain. Okay, then you, for example, we are considering an abdominal pain. Okay, so like this you need to create for what are the causes, what will cause it. Okay, then how I will investigate it. And after investigation, the possible outcome should be this. If this comes, what is the treatment, what is the management of that patient, like that. So that is called mind mapping and visualization, like visualizing yourself at how it will work, like if and else. Okay, so and then we have something called as group studies, which we all have done, but sometimes it works, sometimes it doesn't work. Okay, and sometimes there are some kids which create a nuisance and we are unable to study. Okay, and the last one is like utilizing online resources. So online resources such as, there are various platform. For example, we'll say Marrow, Preplat, Cerebellum, something like that. So you can utilize your online resources, and there are YouTube channels such as Ninja Nerd, we have JJ Medicine, we have Zero to Hero, or like a graphical representing lectures. So you can use the online resources, and even you have a Dopamine, which will be putting out our lectures regularly, which will be in depth for you to understand, so that you don't get left out, and there will be a study materials which will be provided for you. Okay, so these are the points which you need to remember. So our last topic was this only, that effective study techniques should be maintained after hours, like creating a schedule, and then having a proper time management, and what type of study you prefer, and after that preference, you need to put that effective study technique, which is either active recall, which is spaced repetition, mind mapping, group studies, utilizing online resources, whatever you feel you can do it. Okay, and like for example, there are many terms and terminologies in a medicine. Okay, so that time you can, what you can do is, like, you can have a mnemonic, and then you can have checking informations. Okay, checking information, practice retrieval using associate imaginary, whatever you do, it should be like fruitful to you, it should not go in waste. Okay, and at the conclusion, I would say that recap of your key points, whatever you have studied, encouragement to implement your study techniques should be there in you, and again, please have your time management, have a balanced college and your personal life. Give yourself a time. This does not mean that you are 24 hours addicted to the books. Okay, and if you have any questions, if you have any suggestions, okay, you can just type in the comment and send it to us. We'll be happy to review, we'll be happy to reply to it. And I'll and even if you want to send a mail, you can send the mail. If you want any topic to be like the next lecture, then you can comment it down. And don't forget to subscribe this channel, because we are coming up with more and more, like what do you say, more and more creative way of teaching, and high yielding medical lectures. Okay, and that's all for this video. I hope you liked it, and I hope that it might have taught you, or it might have give you an idea how to study. Okay, so let's end this topic here, and don't forget to subscribe. Thank you.